Welcome to the Vet Med Wellness and Leadership Podcast, where we discuss central challenges vet med leaders face, such as burnout, stress, and difficult interactions with clients and staff, just to name a few. In each episode, you will hear about actionable solutions that you can apply to your practice and invitations to connect with fellow leaders who are passionate about improving the wellness of the vet med profession. By subscribing, liking, commenting, or sharing this podcast, you are helping more veterinary professionals find the resources shared in these episodes. Thank you in advance for listening and supporting this show. I hope you enjoy it. Hey everybody, Crystal Stokes here, and joining me today is Dr. Glenn Robinson, who has served in multiple leadership roles where he found his passion for helping teams develop skills and strategies to lead at the clinic level. He currently works with veterinary teams on workflow, on-site leadership development, and strategic planning for growth as a clinical coach and consultant. And Dr. Glenn is joining us today to narrow the scope down on how he helps support veterinary leaders in better understanding and managing their clinic's financials. So, Dr. Glenn, can you just take us back in time a little bit and tell us, how did you go from being in-clinic veterinarian to a coach and consultant? Give us a Cliff Notes version.
Yeah. Well, thanks for having me. I appreciate being here. And the Cliff Notes version is, as a practicing veterinarian, had a lot of opportunities to see and learn, obviously, medicine. But one of the main things that you start to learn very quickly in your career is what you weren't necessarily taught in medical school or vet school and undergrad is how does the money influence these decisions, how to have tough conversations, how to be a leader. In those areas, I realized that just, retrospectively, I'm lacking. I need to do some research, and personal finance was always an interest of mine, but then applying that into the medical concepts was where I got really interested, became a medical director and got to see more of that, and then became an area medical director where I was overseeing 6 hospitals and seeing how that would play out in a portfolio of clinics. And so I really got a really great opportunity to learn a lot of high value information that I just don't think we share or pass on very well sometimes because we're so focused on, we got to learn the medicine, we got to take care of these patients every day. Veterinarians work very hard, and that's really important, obviously, but we also need to understand why we're working hard. And I think the financials is actually a good way to do that.
Ooh, I really like that introduction. And also, you had this kind of trial by fire. You learn by doing. You're just thrown into it. I think a lot of people listening are probably experiencing that right now. Okay, well, I'm in this leadership role. I don't have an MBA. I haven't been trained on these. I'm not an accountant. And there's that feeling of imposter syndrome that can take over. And I'm sure it makes us want to pull back into our shell. So I love the conversation we're going to have today because I think it's a nice, gentle introduction to how to kind of use medical terminology and ideas. Like you mentioned the treatment plan and blood work and things like that to start thinking about your clinic's financial well-being. So why don't we just start off first with talking about why is it even important? When you were in those leadership roles, how did it occur to you that, it might be important to focus on these? Why should I even bother spending time on it?
Yeah, that is a great question. So one of the reasons that I really focus on these things is because I actually really enjoyed helping my colleagues. And when you're working every day as a veterinarian with colleagues or technicians, receptionists, you'll see we can work really hard and spend a lot of hours doing what we're doing, but are those hours actually getting us to where we want to be? Are we working harder just to keep working hard, or are we getting and accomplishing goals? And that's one of the reasons I think a lot of veterinarians maybe suffer from burnout is that we just feel like we're just kind of like a pitcher. It's just an endless amount of water just being poured over us, and we're just kind of taking it. And we're like, does this end? And while medicine never ends, right? We all know that, but we can know what kind of goals and accomplishments we want to have. And if we're not communicating that well, our team really suffers. And so that's what I saw really early on is financials are really important, obviously, for the main reason, keep the doors open, keep people employed and paid, and get raises. We all agree that we're probably not compensated enough for what we do. In general, we have this shared feeling, whether we're a technician, reception, they deal with a lot of stuff, and veterinarians deal with a lot of things that when you take a look at the actual pay rate, we're like, yeah, it's probably not enough. Well, owners know that too. Well, how do we get to a point we can give raises? Well, guess what? We have to take a little bit of a look at some financials to understand if we want to get 5% raises, we have to justify that by at least making 5% more, right? Like it's kind of common sense, but we do have to think about it and make a plan for it. And what I found is a lot of times people don't make plans. They don't like to think about it. They don't like to talk about money, but it is important for your clinic's health and your future of your staff, because that is something that a lot of times we all unify on. Is very rarely do I hear veterinarians like, oh, I get paid way too much, I'm going to take a pay cut, or a technician, I should probably get paid less. We're trying to figure out how we keep people, and how we do that is we support them emotionally and financially. And so let's look at those numbers.
Absolutely. Like I've noticed a big difference across the spectrum of companies that I've worked with. I think where there's strong financial management, they're aware of how much of a buffer they have and what they want to use it for. So, there's a pie chart, and like what proportion of that pie chart is going to go to building improvements and buying new equipment and paying for health and wellness benefits and giving our team raises and bonuses and having that awesome holiday party that people want to come to. And what about the unexpected? We didn't realize that was going to happen. We had to order a new generator. So, that gives a sense of calm and confidence when you have it mapped out and you know what your buffers are just in case the unexpected happens. You can also project into the future of as the economy changes and things are growing, and we can plan for those things. What about when we go through another downturn and people aren't bringing their pets in anymore? No worries. We had that planned and predicted. So I like the knowing.
Yeah.
Right.
Exactly. That's one of the early talks I have with a lot of veterinarians or medical directors is, financials, making money. These aren't dirty words. We're actually trying to use money as a tool. And I believe that it's a tool for us to accomplish our goals. And we can get there. We just have to blend that language of medicine and money together to make a coherent message that we all create buy-in on. And that's what I really focus on is, hey, I understand like we can't just walk into a hospital and say, we need to make another 20,000 this month or else. Okay. Like we can maybe think of a way to approach this a little bit differently. And so that's one of the main things. Money is a tool. We have to think of it that way.
I appreciate that. What are some of the common myths or mistakes leaders make regarding finances?
Yeah, I think the first one is just not talking about it, to be honest. We usually don't like to talk about things that make us feel weird or that we're not confident in. So my suggestion is always do some self-education. Let's talk about what you're not confident in these numbers to make you feel a little bit more confident. So that way you can share that with your team. And what I mean by that isn't necessarily like, oh, we made $1 million. Let's go tell the team we made $1 million. But we can talk about goals and setting goals that contribute to us making $1 million that they can be a part of and help create. And that's the key. And so we want to create goals that the team feels bought into, because that's where the flaws usually kind of the cracks start to happen there. Other myths, I'm trying to think of a couple other ones, but a lot of times veterinarians, we like to work hard. And the answer is, well, just work harder and do more, and we're going to make more money. And that works sometimes to a degree, but then eventually that usually turns on you at some point. Usually these examples, unfortunately, are clinics that were 3 to 4 doctor practices and are like 1.5 doctor practice 2 years later, and nobody knows why. And secret is nobody's just telling them why they left or they didn't stay. And that's not uncommon, unfortunately. That's not the only reason they leave, but we just have to be careful with that mindset of all we have to do is just keep doing it and keep working harder, and this will work. Sometimes we have to stop and think about that. And then the last one is like, this was a big one for me, is just increasing your prices or seeing more pets isn't always the answer. Now I'm one of the guys that every year we should have a price increase, period. We should have inflation happens. We all know that intimately now. But those two things and just keeping your costs low are just not the 3 easy answers that match for everyone. Those are easy levers. So a lot of people will reach for those first, but just be cautious about pulling that to make a difference in your numbers when there might be something else we can do.
Yeah, I really, really like that. And it's kind of mysterious, but it speaks to, you'd have to really evaluate your clinic's situation and also the economy around your clinic and what it can hold, and be thoughtful about not just using some cookie cutter strategy of like, well, everybody else is raising prices, guess we will too. You're like, well, maybe not. Like, let's really think this through and look at what would happen if you pull that lever versus if we did something else. So I appreciate your way of taking, the magnifying glass out and looking at each situation independently. So can you tell us more about something I found compelling when we were first discussing this topic offline was your ability to simplify finances. Because this is, I think, a lot of people kind of go green. They're like, oh, guys, so complicated. It's like spreadsheets and it's just overwhelming. And I don't even want to think about it. I get nauseous just thinking about it. So how do you start simplifying that?
Yeah. I'm a pretty simple guy, to be honest. So I have to simplify is the answer. If I can't simplify it, then I can't communicate it well. And so I like to take a 10,000 foot view to start with all aspects. And that helps us to kind of start here and move down to that magnifying glass, because if we're not confident with the big picture, we're going to be really not confident when we get really close. So we need to really focus on that big picture first. And for me, I actually use a really basic equation to kind of get an idea where you are today. And then we talk about the opportunities and setting goals for where you want to be tomorrow. And so that equation is a little bit simplified. And I know I just talked about what, those 3 easy pulls. Well, those actually come from this equation a little bit, because when you look at this equation, if you take your average client transaction and you multiply it by the number of transactions you have and you subtract out your expenses, at the end, you're going to find out how much money you made. Mm-hmm. And that is extremely simple, and we can dive 10,000 feet into each one of those. But we may not have to if we take appropriate benchmarks and take a look at the big picture to make sure that we're looking at the right areas first. And so that's what I use. I use a very oversimplified version to start that conversation with teams. And I use it with technicians. I use it with the reception even. I've used it with, medical directors, doctors. Everyone can understand that math. And that's what I want, because I want them to understand the math to understand what impacts those numbers. And then that's where we start to talk about, what do you see when you're there to make the biggest impact?
Oh, I really like that. So then are you then shifting, once you've had that conversation, you've identified this is how much is coming in per transaction, this many transactions you might have in a typical day, week, month, or year.
Yeah, there you go.
Are you then looking at, where can you actually have some measure of influence, and where do you focus your energy? So can you give us an example maybe of ways you've seen this play out, like how it might be different, 2 different examples of how this tends to go?
Yeah, I would love to. So exactly that. We look at the big picture, and I always tell people the reason we look at that in the 3 columns is because what motivates you might be different than what motivates me. And so you might have a deep passion for finding out, how do we improve our ACT, because I think we can do better as a team. How do we see more patients, or maybe just be more efficient? And I think we have the greatest opportunity there. And that's what I care about as a team. Or, hey, here's our expenses. I feel like that's dramatically higher than it should be. So the point is, identify the passion points that the clinic shares, so that way you can identify these areas. And so I'll give you an example of a clinic I worked with where we were looking at their ACT together. And I was like, listen, in this area, I've been around this area for a while, and on average, you're about $50 to $80 lower than the average clinic. The good news is you have a ton of support staff. And so how do we improve ACTs is usually circulating around how we utilize our technicians. And that's one of the first things I always look at, is tech utilization when our ACT is low. And the reason is, if we utilize our team well, our doctors can be more efficient. And when we're more efficient, we're usually providing more care or better medicine, or we have more options as a team. And so I look at tech utilization with their team, and we looked at some data points of what they were doing for preventative care and medicine. And we found that blood work was something that was kind of talked about, but never really used or pushed. And what I actually proposed was, let's look at how we look at routine lab work for pets over the age of 7, and the importance of senior lab work. Because what I wanted to do was create a program that the technicians got motivated to support the idea that every senior pet should be getting at least this basic panel, but we usually recommend the senior profile for these reasons. And this clinic took off with that idea. I should probably back up, to be honest, and say the reason that they were really interested in that is because they were losing a doctor, and they didn't know how they were going to make up the cash flow difference from losing a doctor. Well, when we implemented this and motivated the team members to be a part of this, of why this is important, here's the opportunities we have. When that doctor left, that next month, they were, I think it was $2,000 to $4,000 less than what they were making with that full-time doctor. And so they had made up the difference in just blood work alone, because their technicians, they had all the hands that they needed to do it. They had the doctors that were there to able to support the staff, and they really took off with it. And so that was a good example of how we increased our ACTs by not just taking up doctor time per se, but the technicians became advocates for the patient care that was good for them.
Oh, okay. If you have any other examples, I'd love to hear them. Yeah. I'm also wondering, like, I was trying to envision maybe like I don't want to put you on the spot, but I was wondering if you have any stories about how leadership has motivated the team, whether doctors or technical staff or front desk staff even. So I think that's also can be challenging of how do I communicate this in a way that really truly feels motivating for our team and our culture? Do you have any examples of that?
Like in addition to the blood work one, the big thing that I find with most associates is that they get kind of voluntold of like what the clinic's going to go into directionally, like whether we're going to focus on blood work because you guys didn't sell enough blood work. Like that was not the message we sent. We asked, would you be happier if your senior pets had more routine lab work before they were sick? And guess what the answer is?
Yes. Definitely.
Yeah, I would want that. So automatically we created buy-in by aligning our goals with a financial goal that we set.
Yeah. So I think that what you're saying is that, right, people that go into vet med, myself included, right? I think back to my days as a technician, who's in it for the money? Pretty much nobody, right? Don't go into this industry to cash out. So we're there because we want to see these pets be as healthy as possible for as long as possible and have good outcomes and feel like we're contributing to the well-being of these animals. So I think when we frame the conversation around, we just need to get more focused on what kind of care we actually want to deliver and how to have the conversation with our clients around how to be thoughtful about what we are doing in these appointments and even staggering appointments out. Like, well, with this kind of illness, or, say you have hyperthyroidism and kidney disease, we'd like to be testing every 3 months at this point to keep trends on how well your pet's doing so we can adjust medication accordingly. And if we're getting fluids, how frequently, and let's just go and get that on the schedule. And now you have something instead of being annual where the pet declined tremendously and you feel awful because last time you saw this kitty cat, they were 15 pounds and now they're 7. You can stay on top of it and feel like you're really helping this cat have longer quality of life, for instance. I think that those kind of conversations inspire people. They don't feel like they're doing it just for financial gain, but there is a financial component that is also contributing to be able to do better and better medicine and hire another doctor and grow your practice.
That's a great point. And that is one thing I try to also convey is typically better medicine equals better financials and vice versa. When we do well financially, we're probably providing a higher level of care or at least more of it to people that need it. And so when we're succeeding in this area, typically we are accidentally succeeding in the other, which is a great feeling for doctors. And all we have to do is correlate that with the numbers and the financials to make sure that they understand that, this is not only good for the pet, this is good for the bottom line. What's good for the bottom line is good for your salary. It's good for retention. It's good for improvements. And this is what we want to do with that bottom line. And I'm very forward with team leads about communicating what you want to do when you get there. And so don't just set a goal to move the goal. Like that's very disheartening to a team. Set a goal and have an outcome that you're going to provide. Like that's pretty simple. I know it sounds weird, but we are super guilty of that. Like, oh yeah, we want an ACT of 280. And then when we get there to $280 per client, we say, well, we could probably do like 305 now because, inflation, times have changed. And then it's like, okay, but reward the 280. That's a great accomplishment.
Yes. And what are some ways that you have seen rewards done well? What would that look like?
Yeah. So rewarding the whole team, I think, is important. So making sure that we communicate what that goal is and sharing that reward with everyone. Sometimes rewarding individuals for individual performance can be challenging and create some, I don't want to say distrust, might be not the right word, but some tensions inside that clinic environment. And also you don't want to create competition per se in the way of like he versus her kind of mentality. You want to make, hey, as a group, we did this. So I believe in clinic-based goals. Individuals can be like documented if you want to reward that way, but just be cautious about those kind of reward systems.
Ooh, that's a really, really good point. I wonder if you have any other examples of either, situations that went well, like, hey, we tried pulling this lever. It's a different lever than the one you just described, like in blood work that went well. And, or perhaps maybe a difficult financial start where you're meeting with someone in leadership and it is hard, and how you overcome that challenge of either resistance to looking at financials or perhaps there's a really messy situation and how we sort of sort through it to get to some common ground. Yeah. Let me paint a few more pictures for us.
Yeah. Another one is often is like the number of transactions, right? And so there's kind of two big categories in veterinary hospitals. There's like the number of doctor appointments, which tend to be higher transactions. We understand that. That's logical. And then basically non-doctor appointment transactions. And so we can kind of turn this number up using different kinds of transactions, being sure that we're aware of the influence of the ACT. And so some people will look at like tech appointments, for example, and how can we utilize tech appointments not only to help our patients, but actually create a profit source per se and keep them busy? Or how do we get doctors to see more pets? Like we talked about one of the big myths, like, oh, just work in another 2 today and do that every day for the rest of your life. And you're like, well, what we actually do and what we want to talk about is how we make their day easier. And so I think the best example of that is working with a doctor team that routinely saw 12 to 14 patients per day. And I always tell people to start like, there isn't like a real hard number. Like you have to see 18 and do this and you will be successful, because if you can make $500 per transaction, 12 patients might be all you need to do. Like that might be it. I'm not saying that's what they were, but what we decided in that situation was that was our greatest opportunity. And when we dug and held down the magnifying glass, we realized that the doctors were really overwhelmed with writing notes, doing callbacks, really loaded with things that were not seeing patients. So therefore their schedule, they couldn't work in another pet. They couldn't make a 20-minute appointment because I needed all this time to process things. And that's where you have to kind of look into it. And so that was a little bit of a sensitive subject, because as an operations kind of mind person, you're like, just makes sense. You need to see more pets. But if you don't ask why or what we can help them with, then that comes off extremely poorly. And so we actually talked about how do we make their day easier, workflow suggestions that would help their doctors get through the day a little bit easier. Big one was tech utilization. In that situation, we talked about how we utilize our technicians. When do we feel comfortable, or why don't we feel comfortable? So then we realized there's a tech onboarding and training issue that made doctors feel there's things they can and can't do. Anyway, point being, it was a sensitive subject, and just coming in to say transactions need to go up was not the right message. But we got the message across in a positive way when I said, I want to make your day easier, and I bet you would like to see and help more pets. And they're like, of course, you have a waiting list of 3 weeks. Why wouldn't we want to see them sooner? So that was a little bit sensitive of a topic, because it was usually two messages that were not being well received by either party.
That's a great example. And this is so much of what I feel like we deal with in Full Circle Lab is, coming in because we have retention issues. Like, why are people leaving? And when we really dig down, there's always like the root cause analysis of what we do. And we initially step into a clinic is you uncover all the friction points within a hospital or, region. And sometimes it does come down to these things around workflow, or are we training our team, appropriately, or do we have the technology in place that can really support the type of workflow that we are aiming for? And is it sustainable, right? We go through seasons. We have the busy season, puppies and kittens and all that stuff. We need to be able to plan accordingly and make sure we are set up for success. Because this is really not a sprint profession. This is a marathon.
Yeah, it is. It is. And for that situation too, what was actually another factor was the doctors were pretty upset because they felt like they needed to be paid and compensated more, because they were working very hard and very busy. But we had to show them the math and the financials of how that's calculated and why, in order to improve what you get paid. I just need you to be able to produce more so we can pay you more, is a short story. And then all of a sudden the little light bulb kind of clicks of like, oh yeah, if I want this kind of cash, I need to make this much money, which is true no matter where you go.
Right.
So it's very non-biased. That's what I do like about financials is it's pretty not biased stuff. Like, I can pay you X percentage of that number. How do we change that number?
Right. And it puts you you have that feeling of control now. It's not mysterious. It's not like you're playing some mysterious game. You now can see it clearly mapped out, and you're empowered. And I also think that it helps us start thinking about not can or can't I, but like, what are all the different resources we have around us? We have technical staff, we have assists, we have the front desk team, we have technology that we can use. We might have, partners that we refer out to. Like, what are all the different ways that we could optimize how we are going about our day to be able to meet that goal. And like you said, it's not always just increasing prices. It might be more about efficiencies and workflows. That's the real answer there. Because if you raise prices and you're still not efficient, it's just like you feel like you didn't even move the needle, and it's very frustrating.
Yeah, and that's what we want to avoid is like working harder to work hard and not show our results for what we're trying to do. So that's one of the main things for me.
I really am enjoying this conversation. Are there any other strategies that you've seen well done that do get like the associates excited about this? Because I from the leadership perspective, say you're an owner or you're on the corporate side, like regional leadership, and you really care about your associates. They are the lifeblood of your hospital along with the technicians, and we want them to feel bought into the process and excited about what can happen. So have you ever seen like when it's done well, what does that look like of getting them excited about this process of looking at the financials?
Yeah. No, that's good. Great question, honestly. We kind of talked about it a little bit. The first one is it directly correlates with your salary. It's a short story. And I don't mean to like harp on it, but like your success, we want you to be successful so we can do these things and pay you more. And the company should do that. If I make 20% more, we should see an improvement of your salary period. So that's like really superficial. But as far as motivating associates, it's having these kind of conversations routinely in an environment that's conducive to accomplishing their career goals as well as the clinic's goals. And I think sometimes we don't do that well enough where we'll do a yearly review and we'll just talk about all the things in this past year that you did great, some things you have opportunities, and we'll see you next year. Here's the raise of like dollars. Yeah. And that's not nearly enough to actually grow people. And the way that you do that is being very purposeful with it and spending time to have their leadership talk to each one about it. And I would recommend doing that at least quarterly for an hour of like, here's where you are. What goals do you have for the next 90 days? What can I help you with? How do you feel this is going? Oh, by the way, thank you. Thank you for doing this. But that's what I try to preach for associates being motivated. Because in general, like we talked about, doctors do want to work hard, but we might be feeling we're working really hard. We don't understand why we're not getting rewarded. Well, that's because we're not being effective is the short answer. And so we can be really efficient, be really good, but if we're not being effective at accomplishing goals, it's really hard to compensate according to that. And they want to hear know that their voice is heard. And the best way you can do that is have them be a part of the goal setting,
Right.
As a clinic, here we are today, guys. We would like to do this or this or this. Here's like 3 to 4 options. Which one of these 3 or 4 are you guys passionate about? And let's talk about why that's important. And then let's correlate that with a goal. So.
Oh, so good. Because yes, those people who, if you have a medical degree, you are ambitious and you like setting and achieving goals. That's how you got here. So leverage that innate quality within veterinary medical professionals. And that's a huge win. Can you also just share with them what you had shared with me offline about kind of looking at your financials to blood work?
Yeah. So the biggest thing it's kind of a big picture thing, but veterinarians, I like to make sure that we're all speaking the same language. So we blend medicine and business together. And basically what I like to encourage people to think about financials and numbers are like blood work. Okay. It's incredibly important for us to have blood work on patients that routine health blood work, but also when they're not feeling well, what's the problem? We need to pair that with a good physical exam, right? So we have blood work and a physical exam to get a big picture of what's going on. If we don't understand or look at the blood work side, we may be missing things about this patient that we had no idea based on our physical exam. And every doctor understands that. Every technician, everyone with some medical knowledge understands the importance of blood work to do that. But we don't always think about or talk about financials in the clinic. But it's such a big part of the big picture that if we don't, we could be missing something. And missing things could be indicators of future stressors on this practice. If we didn't look at our new clients are trending downward or our ACTs are trending downward in a market that it shouldn't be, we need to start asking questions. And so if we wait too long, we might miss our opportunity to make a good positive impact. So I use it like blood work. Financials are blood work. Your workflow and your physical exam of your hospital, pair those together and we can make a plan of what's best for you.
Yep, there's your treatment plan. Ta-da!
It's right there. Yeah. And that we do it all day. We do it all day. And, that's why I like working with veterinarians is because their brains work in the right ways to solve problems because that's what we do all day.
Exactly.
Now, give them a problem that's, I don't want to say worth solving because saving patients is worth solving, but also this is worth solving and talking about. So let's get them included in that.
Exactly. And I'll say too, that in veterinary medicine, we are a group of people who love to learn. You've shown that you're actually really good at learning. Look at all the things you had to learn. So this is just one more thing, right? It's just one more thing to learn, just like you learned biochemistry. You can learn finances. It is there's information out there. There are people like you that can help make it, start off simple and then build the complexity as you go. So it's not so scary. And I think we can take the kind of stigma out of it, make it less taboo. So as we're coming down the home stretch here, Glenn, first of all, I just want to say how much I appreciate the way you describe this topic. I think it feels much more warm and cozy now than I thought it could be at the beginning of our podcast recording today. And as people are listening to this podcast, knowing they're busy, they might be driving in their car, distracted. Sometimes I listen in the shower, which is probably not the best place to listen to a podcast. But if they're going to only take away two things from everything we've talked about today in our busy, distracted world, what are those two things you really want to drive home today?
Yeah. The first one is money doesn't have to be scary. Talking about financials doesn't have to be scary. It is a tool for you to make your day easier. And when we start thinking about how we make your day easier, it's really nice to start there because it's non-biased. So we can make good decisions based on numbers my goal is to make your day easier, even if it's just 20%. So that's the takeaway number one. Number two is if you're unsure where to start, just talking to someone is the first step, and talk to your team about this because you're going to get so much good feedback just from your team alone. I always encourage that to start. So make sure you get a little bit more confident in yourself to understand where you want to go. But number two is talk to each other and your team about where you want to be. And so I think those are the two big takeaways, honestly. I mean, there's probably a lot more, but that's where I would start. So
it's a great starting point. It's super doable. It's just a way to get your toe in the water, having a conversation. Just start where you're at and know that it's one step at a time. And every step you take is in that direction of more financial health for your company, more empowerment to be able to grow and see more patients and clients have a bigger impact in the world that we're playing in here.
Exactly. And if I could just add a third, there's people to help you is a short story. Everyone's worried about how they may look or like, why would I know this? But honestly, no, just ask for help. And I think that's something that we could all do a little better on all the time is just find people that are out there to talk to and ask questions to, because that's where we all start. So.
Yes. Oh, I think that's such an important message. And intuitively, we all know that it's nice to just go to the source where somebody is further along in the journey than we are. We have mentorship for a reason because it's effective. So we can receive that kind of mentorship, coaching, consulting in the area of finances as well. And Glenn, I'm glad you're out there to help us with these things. For those listening who want to connect with you, what is the best way for them to find you?
Yeah, definitely visit my website. Contact information's there. And LinkedIn's a good way to get a hold of me as well. So I always respond. I'll send a message back. And so I'm happy to connect.
Excellent. So I will link that up in the show notes. People can find it there. Glenn, thanks so much for being on with me today. It's been really fun.
Yeah, my pleasure. Thank you.
Thank you for joining me today. I hope that you feel stoked after listening to this episode. And as always, I would love to hear your comments and feedback. Is there a topic that you want to know more about? Please let me know. And thank you again for subscribing and sharing your favorite episodes with others. It really means a lot.